just to make sure that you really understand the concept of the sign of the buttock. Yeah, an important red flag. So, let's imagine. The normal range of motion of straight leg raise is about 90 degrees. And you find in your examination that the straight leg raise is limited. Limitation A. Okay, no problem, happens all the time. But in your examination, you have to perform the passive hip flexion immediately after the straight leg raise. And what you see then, now we flex the knee, and what do we see? Hip flexion is as limited as a straight leg raise. No, it's not as limited. The normal range of motion of hip flexion is this. So in reality, what you see, that hip flexion is more limited and possibly painful than the straight leg raise. So if you would consider that the limitation of straight leg raise is related to an internal derangement, disc protrusion with pressure against dura or nerve root, what should happen when you flex the knee? Immediately you have less tension on nerve roots and dura. Automatically you should go further, but in that case you don't go further. So you can, if you find that, you can exclude internal derangements. Yeah? So what is going to be the problem? The problem is something totally different, some local gluteal problem. So, moral of the story, hip flexion is more painful and certainly more limited than straight leg raise. This is a red flag.